Hello and welcome. This video is part of a series of videos which is being presented on this channel on the topic of publication in medical journals. In this particular video, we are going to talk about case reports as a publication. What is the meaning of case report? What advantage does it have for the author and for the journal in which it is published? These videos are specifically for clinicians who would like to publish articles in medical journals. So what is the advantage to the author who wants to publish? There are several advantages, and we will just go through them quickly. Obviously, if you, as an author, if you are going to start publishing in medical journals, it means that you have certain skills in terms of being able to write, being able to do literature review, and being able to understand clinical problems and how they are solved. It also shows something about your attitude about being involved in academic activities. And these skills and this attitude is of importance in terms of credibility and recognition and of career advancement. Apart from that, your publication will contribute to scientific knowledge. And if someone reads your case report, either at a national level or on an international level, they may contact you because they may be also interested in the same topic. So it provides a lot of opportunities for collaboration and for networking as well as for education. So a case report actually is a detailed description of a particular clinical case which is you have encountered in medical practice. So you may have encountered this case as a part of a team. And so if you are a medical student or doing a house job or as an internee or a resident in training or a junior consultant or a senior consultant, you can still write a case report. And you can, if you are junior, then you can have a mentor who is a senior to you, who will help you and guide you in writing up the case report. The report will typically focus on an individual patient or a very small group of patients who present in a limited time frame. And these patients may present with unusual symptoms or rare symptoms. And the disease also may be unusual or rare, and treatment outcomes are also important to document. Case reports provide valuable insights into the diagnosis, the management, and the prognosis of rare conditions, unusual presentations of common conditions, or unexpected treatment responses. Two examples of case reports includes recently in 2016, a report that was published on abnormal placental invasion, a novel approach to treatment. In this particular article, a small number of cases has been reported as a case report. Another example is a report that was published on placenta percreta induced uterine rupture at 7th week of pregnancy after in vitro fertilization in a primary gravid woman as a case report. So through these titles, you can actually search for these case reports and you can read them through thoroughly. Generally speaking, the minimum amount of information that is included in a case report will include an abstract, an introduction, which includes the literature review, a detailed case presentation from the initial presentation to the final conclusion, a discussion part, and references. However, you have to carefully read the instructions for authors for writing a case report in the journal in which you are hoping to publish. You must follow the instructions very, very carefully. So the question is, how does a case report contribute to knowledge? The contribution is especially in very rare or unusual clinical cases that may provide valuable insights into disease pathophysiology, diagnosis, and treatment. They serve as an educational tool for medical students, residents, and clinicians, providing a real-life example of clinical conditions and their management. They may prompt further research or investigation into a reported condition. Overall, case reports play an important role in advancing medical science, in promoting clinical learning, and improving patient care by sharing valuable clinical experiences and observations within the medical community. So let's just go through the responsibilities of the author if they decide to write a case report. So the first most important responsibility is to select your case. Identifying suitable cases for reporting can be challenging, especially when focusing on a rare or a unique condition. And you must try to balance the novelty of the case and the clinical relevance of the case, with considerations such as patient consent, availability of data, and ethical concerns. So interpretation of the findings is important, and it has to depend upon consideration of the patient's medical history, the presenting symptoms, diagnostic workup, treatment outcomes, and follow-up data. You must try to avoid interpreting or extrapolating beyond the available data. Data collection and documentation can be very challenging because you need to have very sound and very accurate documentation of all the information, which includes the patient's medical record, if they have any lab tests done, what kind of lab testing was done on what kind of equipment, and if there are any images that have been taken and which have been important from the diagnostic workup as well as the diagnosis itself, then these images must be collected and transferred to the computer. And the images have to be in a high enough resolution to maintain clarity and detail when reproduced in print or displayed digitally. This will ensure that the image remains crisp and visually appealing. So all these important aspects of data collection are very critical, and you may need to have a strong infrastructure within your department or within your institution, which will help you to accumulate this information. So the other responsibility is to make sure that you write down the treatment and management, and this will include pharmacological interventions, surgical procedures, or even non-pharmacological therapies or supportive care measures. The literature review will be crucial for recognizing the uniqueness and the significance of the case, and for identifying similar cases, relevant guidelines, and potential knowledge gaps that your case report is going to address. Effective communication of the case findings in a clear, concise, and structured manner is essential to convey the clinical relevance of the report. Researcher has to adhere to the journal guidelines and standards for case reporting, which includes formatting, referencing, and language use. The discussion is a critical analysis of the case, including its clinical significance, and this may involve comparing the case to similar cases reported in the literature, discussing diagnostic challenges or treatment dilemmas, and highlighting lessons learned from the case. So we can ask ourselves this question, that why do journals publish case reports? What is the advantage that a journal has if they want to publish a case report? So a case report can present a unique or a rare case which will attract interest from the readers and other researchers. And this novelty can enhance the reputation of the journal for publishing groundbreaking content. Case reports also contribute to the medical literature by providing information on unusual presentations. As an educational tool, it also helps medical students, residents, and practitioners to learn about different clinical scenarios and approaches to management. Often case reports describe either an individual case or small case series, which may not be representative of broader patient populations. As such, the findings may not be generalizable to other patients or settings. There are certain disadvantages that journals will face because if they publish a case report or they decide to publish case report in their journals. Uh, Generally, a case report will have limited impact, and so this will influence the impact factor of the entire journal. Journals may also have limited space for publishing articles, and that is why generally they will be very strict in the length of the article which will be published as a case report. Ethical considerations is a very important part of the case reporting, and publishing cases uh, requires obtaining informed consent from patients, which can present with ethical challenges, especially in cases involving sensitive information or vulnerable populations. At times, the consent may also be difficult to take if the patient is incapacitated or if the patient does not speak the language. Failure to address these ethical concerns can damage the reputation of the journal and the publisher. With this, we come to the end of the video. If you like the video, please press the like button, share with colleagues, give comments, and subscribe to the channel. Tap the bell icon to be notified of further videos. Thank you and goodbye.